Hi there, it's Dr. Liz. This is one of a few quick minutes about your skin. Did you know that the skin has three layers? The epidermis, the dermis, and the hypodermis. Depends how you count it. There's a lot more technicalities with the skin, so you might find 7 layers or 10 layers, but that's an easy way to think about it. The epidermis is the outermost layer, the waterproofing of our skin, the number one barrier against infection. Also, of course, our skin helps regulate temperature. The epidermis also has the melanocytes, the variation in which determines our skin tone, which of course is as vast in variety as even more than the rainbow. The dermis is the thickest layer of our skin. It is 90% of the thickness of our skin. The hair follicles are there, the sweat glands start there, blood flow, all kinds of things going on there. At the bottom is the hypodermis. This is the cushion layer, cushions the muscles and the bones, has the larger nerve vessels, larger nerves and larger blood vessels. Lots of important function there as far as regulating our body temperature. Think about those 3 layers when you're taking care of your skin. But did you know that 1 square inch of your skin has at least 19 million skin cells and 60,000 melanocytes? That has the different pigmentation amount in our skin. Also 1,000 nerve endings and at least 20 blood vessels. All that going on in every square inch of your skin. All the time, our skin is shedding. At least 40,000 cells per day are shedding, meaning that about every 30 days, you have all new skin. I have a few do's and don'ts for you, for your skin. Couple of simple don'ts. Don't smoke. As I always say, most people who smoke know they shouldn't, but did you know that it really makes your skin look terrible? So maybe that's a motivator. If you or someone you care about smokes, you can try to get them to cut down, or even better, to quit completely. The other don't is don't tan on purpose. Okay, I was one of those teenagers that put on baby oil, went out in the sun. Were you? Yeah, not good. Don't do it. Tanning beds, not good, right? So don't tan on purpose. Your skin does not appreciate it, and you will not appreciate it many, many years later. A few do's: do take good care of your skin. Use gentle products, clean beauty products as a maintenance. Fine, you do some procedures sometimes, like the peels and the treatments. There's other procedures, I understand. I'm not talking about those. I'm talking about just skin treatment approaches. But on a general maintenance basis, keep it on the gentler, clean beauty side. Manage your stress. I know this is obvious, easy for me to say, but do everything that you can. This is going to help your skin. And the last for right now, get regular skin checks. Somebody else, a dermatologist, preferably, it needs to just really take a look at you head to toe. They're looking at parts of your skin that you cannot see. Once a year is the usual recommendation, maybe more often if you have something that they're following, or if you have a family history. Take care of your skin. It's the largest organ of your body. I often get asked the question, what does medical grade skincare mean? Well, let me tell you a couple of points that it means. Number 1 is it's usually higher percentages of the active ingredients. So everyone knows the difference between over-the-counter strength of something versus a prescription strength. A lot of medical grade skincare, you don't need a prescription for the pharmacy, but it's usually only sold through doctors or nurse practitioners. The other aspect of medical grade skincare is that there are verifiable, tested quantities of these active ingredients. There's a lot of people out there who can make their own products, sell their own products without a third-party process of testing and verifying what is actually in there.
Thanks for watching. I'm so excited that you want to feel your best so you can go out and do your best. Don't forget to like and share and subscribe, and leave me a comment or a question. I will look forward to that. Talk with you soon.